see. Yay.
Yes.
We are live. Welcome everybody who is in here. I just want to introduce myself first and foremost. I am GlamPreezy. Welcome back to my channel. Thank you guys so much for tuning in today. If you are new here, I talk about everything fibroids. I talk about my journey with fibroids and things that I've done to help to manage my own fibroids naturally. But today we are going to be talking about a very specific topic. You guys have asked me lots and lots of questions about fibroids and fertility, ladies. So I brought a special guest on. I'm really super excited to talk about this because we finally have somebody to answer our questions. So go ahead and introduce yourself.
All right. Hi, everybody. It's so exciting to be here. And thank you so much, GlamPreezy, for having me. I'm here talking about one of my favorite topics, which is fibroids, and specifically as it relates to fertility. And I know this is a cause of great concern to so many women, so I'm really excited to be here. I'm an OB-GYN by training. I'm a minimally invasive surgeon as well, and I practice in the San Francisco Bay Area, where I run my own private practice and spend a lot of time taking care of women with fibroids, fertility issues, endometriosis, pelvic pain, and provide boutique care for women through all phases of life. So that's me in a nutshell, and I look forward to answering some questions and interacting with you guys today.
That is so awesome. Do you mind dropping your socials in
Oh,
here
yes.
or letting us know where we can find you?
Yes, absolutely. So my social across all channels is the Fibroid Doc. So THE Fibroid DOC. So that's on Instagram, TikTok, and we can also post my website information at the end. And feel free to join my email list because every month I send out information on fibroids. I just put a pre-op checklist, post-op checklist, all the things that I think you guys will find really, really helpful. So check out my social media.
Yay, that's awesome. And I will, when you're answering some of the questions, I'll make sure to pop some info into the chat for the ladies as well. So we're going to start off with some questions. I asked you guys what were your most pressing questions. So we really want to get straight to it. I'm going to get into the list with number one. Someone asked timing after procedures. So what is the best timing to try to conceive after a myomectomy or after UFE, the question says.
Okay, so it kind of depends on what type of myomectomy you're having. So if you're having a hysteroscopy, which is a procedure that's done, vaginally, we go right with a camera through the vagina and into the uterus to remove a small fibroid. That procedure has minimal downtime, meaning you go home the same day, recovery is pretty quick, and time to conception could just be one cycle, so maybe 4 to 6 weeks. And versus if you're having a larger procedure like a robotic or an abdominal myomectomy, where we're taking out multiple fibroids and we're actually making incisions through the uterus, that is going to take a minimum of 6 months. So we definitely do not recommend women getting pregnant sooner. And this is because as the muscle of the uterus stretches to accommodate a baby, if it hasn't well healed, if it's not well healed, then it can actually rupture, which is catastrophic to both baby and mom. So a lot of patients who are trying to get pregnant are very antsy to get pregnant as soon as their surgery is over, but it's super important to wait the minimum 6 months if you're having a big procedure and you've had multiple fibroids removed. So it's always a good idea to ask your surgeon at the end, just to confirm how many months do I need to wait, but it's a minimum of 6 months.
Wow. Okay. That was
Yeah.
very enlightening. I didn't know half of that information. Thank you.
Yes, yes, and that's really why we tell people to wait. It's not just like, oh, because you're healing. We need you to heal, and we need the uterus to really hold up, when you do get pregnant, because your uterus is going from a small, you know, grapefruit to like a huge watermelon, right? So if you imagine all that muscle stretching, you want it to be in good shape, and you don't want to get pregnant too soon.
Wow. Okay. Great. Thank you so much for answering
Mhm.
that question. I have another question, and this seems to be a little bit more of a general question, but it says, do fibroids make it harder to get pregnant, and which types are most impactful?
Yes, this is a great question. So, fibroids in general, through a mechanism that we don't fully understand, just because you're somebody who has fibroids, that reduces fertility, even
Mm,
if it's not protruding into the cavity. So to answer the question of, well, what types of fibroids are most impactful? It's those that are pushing into the endometrial cavity. Um, I had a, I was going to say I had a little diagram here, but it's when we think about where fibroids can be, they can be in the wall of the uterus, they can be hanging off the top of the uterus, or they can be inside the cavity, which is where a baby forms, which is where you bleed from during your period, right? We don't want ideally any fibroids inside the cavity. So if you've got fibroids inside the cavity, you must remove them prior to getting pregnant. So that one is the most impactful. You can sort of get away with other fibroids in the wall or on the outside, and you don't always have to remove them, depending on the size. But the ones inside are going to make it very difficult for you to get pregnant, because if you think about an embryo going and implanting, it could just bounce off that fibroid and not implant. Whereas if the fibroid had not been there, it would have been a good spot to implant. So there's something to think about when we think about pregnancy and fibroids. And I have a couple patients who have like 30 to 30 fibroids, and they're all tiny and they're not in the cavity. But again, just because of having fibroids, they exert some sort of effect on the uterus that makes it unfavorable to get
mm.
pregnant. So this is something we really want to be on top of if you're trying to get pregnant.
Okay. Yeah. That is, that seems definitely very pertinent location. I want to just go to the chat really quick because we have a question in the chat. And she
Mhm.
says, how fast can a fibroid grow? And does one have to be worried about a 1 centimeter fibroid?
How fast fibroids can grow really depends on the person. A 1 centimeter fibroid may take years to grow into a 3 or 4 centimeter fibroid, or it may never grow. So if you've got a 1 centimeter fibroid, as long as it's not in the cavity, it's not something you particularly need to be concerned about. But if you know you have fibroids, I would still keep getting ultrasounds every few years to check up on them, because I can't tell you how many women in their 30s have said to me, oh, yeah, when I was like 20 years old, somebody told me I had a fibroid, and then they never did anything or checked on it, even though there was nothing to do at that time. They never checked up on it. And now it's, an 8 centimeter fibroid or a 6 centimeter fibroid, and now it's posing a problem. So, yeah, it's good just to keep tabs on it. And I do want to mention, by the way, I'm talking a lot about medicine, but this is not medical advice for any specific person. Please take this information and then go speak with your own gynecologist about, what you want to do. But yeah, just wanted to throw that out there.
Yes, absolutely, ladies. Always, always, always talk to your doctor about your specific case because fibroids can be variable from person to person, and everybody's situation can be different. So let's get back to the list and let's ask about miscarriage risk. I know this is a touchy topic for a lot of ladies, but many women ask me about this. And she says, how does size and location affect risk? And I know that you kind of talked about location a little bit, so maybe expand upon the miscarriage risk factor here.
Yes. So if we've got a fibroid again in the cavity, no matter how small it is, it can definitely cause miscarriage if your embryo happened to go and like implant right on that fibroid. Now, if your fibroid is not in the cavity, but say it's in the wall, or maybe it's kind of growing on the outside of the uterus, if it's large enough, it's going to indent or push into the cavity. So maybe it's not inside the cavity, but it's large enough that it's kind of pushing in. And again, you sort of end up with a similar effect where you don't have that nice normal shape of a cavity. Now you've got a little indentation where again, that embryo can go and implant. So what we are looking for is a nice smooth endometrium or cavity. So that's what we're looking for. So if anything is disrupting that, that could be a problem and can cause miscarriage.
Okay. Yeah, I can definitely see that. Okay, so we do have another question here. It says, trying to conceive with fibroids, when to seek help and what to ask your doctor when you're having an appointment related to you wanting to get pregnant when you have fibroids.
Yes. So this is the kind of patient I see a lot, having fibroids and, desiring pregnancy. So the first thing I would do is I would seek out a specialist. And the reason I say this right off the bat is depending on where you're in the country, getting an appointment sometimes can take weeks, if not months. And so you don't want to go to your general gynecologist and then say, oh, well, you need to see a surgeon, or like, I don't do the surgery. Then you got to wait another 6 months to see a minimally invasive surgeon. So the best thing to do is before you even go, make sure you're seeing the right type of doctor, make sure you're seeing somebody who does these surgeries, and so they can give you right then and there the correct advice. Um, if you can get an MRI of your pelvis before you have that appointment, that's even better because that is the gold standard in terms of surgical planning when we think about imaging. So an ultrasound is okay, but an MRI is even better. So if you can have an MRI, prior to going to that appointment, that would be great. And then you want to go with those. You want to talk about your plans, really get an idea of where these fibroids are, how big they are they impacting the cavity? That's again the number one question. Um, and, is surgery really necessary at this point? And what are the risks then of not having surgery? Are there complications that can happen after I get pregnant with these fibroids? And again, it depends if you've got one fibroid or you've got 30, right? There are two different things. And so um, really understanding that risk, knowing the timeline, and then a lot of people want to get pregnant naturally, but I would also just talk about IVF as well, just so you have all that information in one appointment and you can just process that. It doesn't mean you need to do IVF, but just ask your doctor, do you think for me, IVF would give me a better shot at getting pregnant? And of course, it depends on your age. If you're 28 versus 38 versus, 42, those are going to be very different answers. So talking about assisted reproduction, like IVF, talking about, surgery, talking about risks of having surgery and not having surgery are all important during this consult.
Wow. Okay. We also have a question on here about IVF, and it says, when does IVF make sense for someone with fibroids? So I guess that would go right in line with what you were saying.
Right. I think age is the number one predictor. If people want to try surgery, people want to try naturally, fertility is it's not a perfect science, right? So things happen. You may be able to get pregnant despite having fibroids, but if you've got age on your side, as in you're younger, you've got a little more leeway, versus if you're older and you're like, okay, I don't really have a lot of time, and I got to do the best thing, get all my ducks in a row and just throw everything at it. And so in that case, often IVF may be better. But this is why you want to bring that up in your initial consult.
Okay. And I have a question for myself, actually, when it comes to IVF. How does, I guess, timing work as far as IVF and fibroids? Because I've spoken to a lot of women who have gone through rounds of IVF and felt like it made their fibroids grow. Like, how do you time this whole thing?
Hmm. Yeah. Um, yes, we've got some patients who, the IVF medication stimulates the growth of fibroids. And this is true for some and not for others. So it's hard to tell who's going to experience growth and who's not. Usually, Since there's a waiting period anyway after surgery, I recommend that patients first have surgery, and then in those 6 to 8 months that they're waiting in between, do their egg retrievals at that time to make the embryos during that time, so that you feel like you're not just like wasting time, and you've taken care of the fibroids, and so now they're not going to, suddenly be rapidly growing because of the medication. Which, by the way, even if they do grow, they often go back after the cycle. So, if you're trying to optimize your time, the best time to do those retrievals are after surgery.
Okay, wow, that was very informative. Thank you.
Mhm.
Okay, so while we are talking about surgery, let's answer this question. And it's talking about treatment choices for future fertility. And it says, when might UFE be appropriate versus a myomectomy?
Yes, so UFE is definitely a treatment option for fibroids. It is not my number one go-to for those who are trying to actively get pregnant, and this is because the way UFE works. Actually, we should be clear on what we're talking about, whether we're talking about just the fibroid or the artery, because there's two types of embolizations. So
Mhm.
UFE refers to just the fibroid. So we're putting this probe right into the fibroid and causing it to heat up to high degrees, and then just kind of necrosing, or that those cells dying off. So 50% of the fibroid over the year will actually shrink. So that's that. And then UAE, which is uterine artery embolization, is where we put little pellets right into the uterine artery that cuts off blood supply to these fibroids and causes them to shrink. So let's talk about UFE first, because I think that's what the question was about. The UFE is still a little bit controversial in terms of, is it recommended as the first line treatment for those who are trying to conceive? Because number one, it doesn't take away the fibroid completely. Oftentimes it shrinks it, but if that fibroid is large enough that it's causing effects into the cavity, it probably still can. And then during pregnancy, it can sort of grow back. So it's not again, I don't love that procedure for those who are trying to get pregnant. A myomectomy, even though it's a little more invasive and it's a surgery, it's very clean in that, like, it's going to remove the whole fibroid, and so that's I think still the gold standard. UAE, which is the artery embolization, also because it cuts off blood supply to certain parts of the uterus. Could there be effects as the baby grows? Are there portions of the uterus that are not, being well supplied with blood? Could be. So it's again not our first line option. We prefer a myomectomy. Now, have I seen people get pregnant with UAE and UFE? Yes, absolutely. And there's more studies coming out that this is okay. But currently, I wouldn't say it's like the number one treatment over myomectomy. So myomectomy still is sort of the gold standard.
Okay. Wow. Yes. Okay. All right. So let's ask this question, and it's about at home steps that people can take to improve chances of conceiving, like cycle tracking or stress management, nutrition, etc. Like, what things can people do on their own to help their chances of conceiving when they have fibroids?
Yes. So I think reproductive health is just basic health, right? So there's nothing that is so special about trying to get pregnant. Um, but this is something we all should be probably focusing on, on a day-to-day basis anyway. The more healthy we are, the more healthy our uterus is, the more healthy our sperm is, the more healthy our eggs are. So a few things that I recommend to my patients, and I think there's more literature coming out on this. Number one, really focusing on a plant-based diet as much as you can. And I know there's some controversy about this. Everyone follows different things, but there's more and more data coming out on plant-based, especially cruciferous vegetables like broccoli and cauliflower. Um, Number two, sleep. Sleep really helps the immune system, helps us recover, and helps all our cells in our bodies. So, getting a good 8 hours of sleep without distraction is key. Number three, physical activity. So, really moving, cardio, weights, really keeping your body in shape and you know, doing that on a regular basis helps our overall health and also our immune system and lower stress. And so I cannot emphasize the importance of all of these things into our, reproductive health as well. One more thing I will add is acupuncture. Acupuncture has really shown to also help with specifically fertility outcomes. And so if you can, getting a little bit of acupuncture to relieve stress, be mindful, be more calm, and help when you're trying to get pregnant is great. And then if you're trying to get pregnant on your own, whether you're fibroids or not, ovulation tracking with the ovulation test kits is great. If you go on my YouTube channel, I have a whole thing about, how to do that. Um, and I'm not a huge fan of all the apps. There's so many apps now and so many different like pee here and it's going to give you all these enzymes and what's high and what's low. I think they're more harmful than helpful kind of at the stage where we are. So just stick to the basics, focus on your general health, which will translate into good reproductive health.
Okay. And then while we're on that topic, I'm just interested, how many hours of sleep per night should we be aiming for as women?
7 to 9.
Okay.
7 to 9 hours. Yep, eight is like the magic number. Some people need 7, but really you should, without an alarm, you should be able to get up and really feel, rested. And that starts with putting away all our technology an hour before, lowering the lights, not drinking caffeine later in the day, all of those things that go along with it. But yes, sleep is magic.
Okay. And then before we end this, I want to grab a question from the chat. And she says, how does UAE and UFE compromise sexual function? Or does it?
I wouldn't say it compromises sexual function. I don't believe there are any studies on that because it's not really affecting nerves, or it's not affecting the cervix or the vagina or any of those parts of our bodies. It's really going after the uterus and fibroids.
Okay. And
Yeah.
then I have one more question of my own. And
Yeah.
this is something that many women have asked me as well. When trying to conceive in this big picture of fibroids, if a woman is on contraceptives or birth control, how long in advance should she be getting off that birth control to give herself a chance to conceive?
Yes, this is a very common question that I get. And it's just 1 month. So if you stop your birth control this month, the next month you're going to ovulate and you can get pregnant the very next month. The only exception to this is the depot shot. There's still people who get the depot shot, which is an injection of progesterone that you get Depo-Provera. It's every 3 months. And so that one does tend to hang on in your system for a little bit longer. So you want to give yourself almost a full year in that case. So if you're like, okay, 2026, I'm going to try and get pregnant, then you want to stop those depot shots this year and you want to maybe try a different shorter acting birth control. But if we're talking about the pill itself, there's really no amount of extra time that you need to give yourself.
Oh, wow. Okay. That's really
Yeah.
interesting information.
Yes, yes. I think a lot of women are thinking they need to get off of it several months ahead, but no, you actually don't.
Okay. Wow. All right. Well, we do have like 5 minutes left in here. Are there any things that you'd like to say before we end this live?
Well, I think when we think about fibroids and fertility, I would love just to leave everyone with this message that timing is everything, and also being prepared early on. If you know you have fibroids, you don't want to wait till you're 35 or whatever your ideal time to start a family is. You want to meet with a surgeon ahead of time. You want to meet with a fertility doctor just to know your options. What is your unique case? Are you somebody who's going to need surgery even, or not really? And in which case, you just continue living a healthy lifestyle and then you get pregnant. But, are you somebody who needs one surgery? Do you need multiple surgeries? Do you need IVF? In which case, you want to start planning ahead of time. I think for me as a physician, that's the biggest tragedy when I see women 38, 39 who are like, what? Like, I need surgery? Like, I never knew that, I had to have all that. And now what? I need IVF. Now they're trying to, make sure they're in a financial position to do that. They have to wait for the recovery from surgery. And now, before we know it, they're already 41. And
Mm,
so, my biggest message is just be more proactive about your reproductive health, especially if you have fibroids. There's no harm in getting a scan in your 20s, seeing it after your 20s, just knowing like, okay, what's my timeline? What do I need? Or maybe I don't have to worry about it, but that peace of mind is really priceless.
yeah, yeah, that sounds like the best advice right there. And especially just
Yeah.
making sure that we're taking care of our reproductive health, as she said, on a daily basis and not doing
Yes.
it as reactive when we want to try to get pregnant. Um,
Yes.
so we'll end the live here. I want to take a moment just to drop her information again, because I know we are going to have some other questions for her. And I would love for you guys to be able to go over to her socials and her YouTube and ask some of these really good questions. Can we have your socials one more time so that I can put them in the chat here?
Yes. So my handle is the Fibroid Doc.
Okay.
TheFibroidDoc. And it's across Instagram, TikTok, and YouTube as well. I release a video every single week on YouTube where we cover fibroids, fertility, surgery, hormones, menopause, surgical menopause, hormone therapy, all the things related to this topic. So we cover a lot of important information. Subscribe so you get, alerts to those videos. They drop every Monday. You can also join our email list where you'll get, I usually send out what's new in women's health, what's new from the conferences I go to. So you just learn more about it and just feel more empowered to take care of your health. So
That sounds
yeah.
phenomenal. I'm going to drop the specific link to your YouTube
Oh,
right
great.
now
Yes.
in the chat, just in case. You guys go and check her out and ask her some of your questions. Thank you so much for joining this live. This is really, really exciting for a lot of us here. We have been waiting to talk about fertility, and I do not have the expertise for this. So I am so, so grateful for you joining us today.
Yes.
And yeah, I hope everybody enjoyed. Hopefully we can do this again in the future and do a nice little
Yeah.
Q&A, because the ladies have lots of questions.
Yes, absolutely. Thank you guys for coming on and yeah, please post your questions. I'll create content to answer those. Okay.
Awesome. Thank you so
All
much for joining
right.
us.
Thank you. Thanks for
Have
having
a great
me.
one.
Okay,
Bye-bye.
bye.
Okay, ladies. So I am going to end the live here. I know this was a short one. This was all the time she had for us. Girl, she is busy. She's running a practice. Okay. So this was the amount of time that we had. If you guys have questions, you can always hit me down in the comments. Always, always. I respond to all my comments. And please go over and check her socials out so that you guys can ask her your direct questions. Y'all know where to find me here on YouTube at GlamPreezy. You can also find me at hotgirlhealthjourney.com. That is my website. And you can find me at Hot Girl Health Journey on Instagram as well. I'm going to drop that in the chat. And until next time, you guys, I love you guys so much. Thank you guys for watching this short live. It's only a quick 30-minute one, but you can always go back through the live and listen to some of her answers to these questions, because I think she answered some really, really great questions. And until next time, you guys, I love y'all. I'll see you guys later.